Welcome to our International Health Project on pregnancy issues in Pakistan. Within the area of Pakistan, maternal mortality, pregnancy nutrition, and proper health care is a problem within the young, and it's lacking for many mothers and expecting mothers. It is said by UNICEF.org that Pakistan's maternal mortality rate is estimated to be between 350 and 600 per 100,000 live births, as compared to 17 per 100,000 live births in the United States. So Pakistan is having limited resources, it doesn't have a very good economy, and it's kind of in a constant war zone. So it makes it difficult for many people to survive, especially infants and young children, and for mothers to receive the proper health care that they should be if they're expecting. The conditions of the country and lack of medical resources make it difficult to raise a healthy child, especially when the mother lacks proper health care and just a typical lifestyle that we expect here in the United States. It is said that during child health is usually closely related to maternal health, and as nutrition during pregnancy, birth conditions, birth spacing, and health status of the mother impact the health of the child. And that's according to Tribune.com. So our goal with our goals as our project continues is to provide nutrition for mothers of the young, for those who are expecting, and to ensure maternal mortality decreases within the area of Pakistan, so that those children can become who are they supposed to be and have an equal chance at life and to be healthy and strong. And same with the mothers who are expecting. So our goal overall is to give maternal health opportunity through nutrition and proper health care.
Now, part of the plan is to have a main clinic or building by which we can store and distribute these health kits, as well as provide educational classes for these mothers and pregnant women in Pakistan. There will also be classes for the midwives so that they can present that information to the pregnant women and mothers all around Pakistan, because Pakistan is quite a big country, and many of them live in rural areas that make it a little bit difficult for people to reach them. Now, the main people in charge will be working in that main clinic. Pakistan natives, aid workers, and doctors will all be in that facility. The people at this clinic would be the ones in charge of distributing the kits, as well as teaching those who will go around and teach others in Pakistan. This is also where the traveling midwives will report on what they have done. Now, Pakistan is a large country, and its population is spread out throughout the country, creating many obstacles for this plan. One obstacle includes the availability of resources from the main clinic being accessible to all of the children and pregnant women. Towns may be too far from the main clinic or very difficult to get to. The solution that we came up for that would be to create smaller facilities in those rural areas so that the kits and classes will be much more accessible. If it's still too difficult to reach, traveling clinics will also be provided. Another obstacle that arises in the funding is the funding for all of the facilities and equipment. Facilities like the ones needed may not be so cheap, especially when it requires lots of special equipment. So the solution for that was to partner up with the organization called Global Giving. They have a program called CARE that provides special relief to those in Pakistan. If we partnered with this organization, we would be able to use it and share their clinics and raise funds through their program.
Women in Pakistan face many obstacles when it comes to becoming a mother. Unfortunately, death is one of these. Pregnant women are not often given the privilege to health care, and most give birth at home with not a very sanitary environment, and the lack of a birth attendant. With the lack of a medical professional, most in labor experience an exposure to dirt and bacteria that increase risk and infection to both the mother and infant. With the lack of education and medical support, many die because of exposure to infection or another serious complication like hemorrhaging. Dr. Kwazia stated, "The root problem is the lack of skilled health workers with the right equipment and medical supplies to support mothers, especially in the most rural and remote areas where they are needed the most." End quote. Mothers-to-be are at great risk of these complications, and because of these conditions, the maternal death rate in Pakistan has skyrocketed. Our goal as health educators is to provide a safe environment for birth and aftercare for pregnant women and babies. We want to also provide medication and equipment to enhance each pregnant woman's health during pregnancy, through labor, and after labor. World Health Organization said nearly every hour a woman in Pakistan dies from complications during pregnancy. As the maternal death rate rises, one of the main reasons is the lack of medical supplies and equipment. Our intervention is to provide each community within Pakistan with a resource that supplies them with much needed medical supplies, medication, and equipment. We're hoping that by supplying these medical supplies will help in the war against maternal death. In these kits, we're supplying each mother-to-be with medication to support a healthy pregnancy, for example, iron and prenatal vitamins. And the kit for each community will contain a handheld ultrasound. By this, birth attendants will be able to spot complications before birth. During labor, the kit will supply birth attendants with tools and equipment to sterilize and provide a safe labor. Also, medications and fluids that will aid in the labor and give each mother a chance to beat the high death rate. In each kit, it will include the following: pregnancy tests, prenatal vitamins, iron, handheld ultrasound, sterile cloths for draping, surgical tools like scalpels and clamps, IV kits, antibacterial soap, gauze, string, plastic sheets, IV bags with fluid, antibiotics, clean baby blankets, clean blankets for mother, medication for birth, for example, misoprostol, which is used to prevent hemorrhaging, clean warm baby clothes, plastic gloves, baby nose syringe, water, and medical disposal bags. By providing these kits with the items listed above, we'll provide each mother-to-be and a skilled birth attendant with the proper tools and resources to increase their chances of having a successful pregnancy and birth. Together we can make a difference in the lives of pregnant women in Pakistan, but the key is together. We need to help from others to make a true difference. We want to partner with two wonderful organizations that will provide us with the resources to gather items within the kits and then distribute them to the communities in Pakistan. These two organizations are Women Thrive Worldwide and Pathfinder International. We hope that through the partnership with these two organizations, we will be able to provide funding and other resources to give each mother-to-be in Pakistan the best possible outcome. There are two barriers that needed to be considered. The first one is that most women in Pakistan are illiterate. This is a big concern to us that has adjusted our way of presenting these kits to the mothers-to-be and birth attendants. Each kit will have to be explained through picture diagrams on how to use them. Using pictures will provide the birth attendants and pregnant women ability to understand what is in the kit and how to use each one. The other barrier is making sure there is enough kits and the struggle to adequately distribute them to communities rurally. We are hoping by partnering with the two organizations stated before will allow us to have the funding to provide each kit to provide to all communities, and partnering with local individuals will enable us to distribute them out to all.
One thing that we wanted to do was have someone that go out to towns or villages. Then we overcome the problem of people not having enough money to transport to the main clinic. And this is a big problem because a lot of the people we wanted to approach were women that didn't have the money to travel to a clinic or have a midwife that knew correct training. This is for the women that are in rural areas that don't have proper training or follow a lot of myths with giving birth, and that causes a lot of damage. So the goal is to use these traveling midwives in rural areas to educate these women, and so that they don't have to spend money on it. So these midwives will be trained at the main clinic that we spoke of earlier, or at any of the smaller subset clinics. Then they will be sent out to the villages, and with the training in the clinics, they will learn with using pictures to teach the pregnant women, and using different skills that will help uneducated women become more educated with this, and using smaller terms so that they can understand things like that. Another issue that we came across was that a lot of women giving birth, because of their culture, don't accept outside help, or outside help doesn't get to know the real problem. And so what we want to do is have Pakistani women be there to help out and to be these traveling midwives so that they know the language a lot better, and they also know the area, and they also will know the culture and be able to follow a lot of that, the things that those women follow in their homes. And it'll make them a lot more comfortable being with someone who is of their own culture. And of course, these women will be taking the kits that we spoke of just before this to each of the village and explaining everything that's in the kit, and they will be making sure that the correct people are getting these kits, whether it's the pregnant women, the pregnant women's parents, or a midwife that's in that actual village that will help out with giving birth to the many different women. And so traveling midwives will really help us overcome the problem with lack of money for people that are pregnant, will help with the barrier of knowing the language, knowing the culture, knowing different parts that people like from America that would be coming and being the aides wouldn't know. So that really helps out with that barrier that we would have. These traveling midwives are also important because they will be trained and they won't be using the different techniques that have previously been used by the midwives or by pregnant women's parents that would damage the child during birth.
So within an area like Pakistan, one of the most important implications we can provide is to ensure that we educate the women on our clinic, the services we provide, what we offer and why, and so that they feel that we are there to help them and support them and that we are not going to cause them any harm. We want to focus primarily on pregnant women and the mothers of pregnant women so that the women feel like they have a support group surrounding them, not only with their mothers but also our clinic. In an area like Pakistan, many women face adversity such as not having any money of their own, inequality, and they have poor health themselves because most of the time they can't afford it, and women are not thought of as equal there. So they think that women are replaceable. So we want to teach the mothers that the main clinic and the clinics that are surrounding are not there to harm them or their babies. We also want to teach them that the nutrition kits and the kits that we provide for them are not to harm them and are not to be sold. Although it may be tempting for some mothers to sell the kits because they need to provide simple needs for their family such as food, it is important that they realize that this will help them overall with a more healthy pregnancy and a healthy baby. So to implement this plan, we plan on educating the mothers by offering free educational clinics at our main clinic site that will focus on giving the mothers knowledge of the important health implications that they need to make it within their lives, such as eating properly for the baby, making sure they have a diverse meal, getting all the nutrients and vitamins that they need. We will also do an overview on what services we offer here at the clinic, such as ultrasounds, having a doctor come in and see them regularly, checkups on the baby, and also labor when it comes time. We will also give them an overview on what we give in the pregnancy kit so that they understand what the tools are for, what the vitamins are for, and when and how to use them. With Pakistan being so widely spread out, we also plan to send out midwives, doctors, and volunteers to go to subset clinics or even just to send out midwives to villages to educate these women on the same things that are received at the main clinic and to give them the same kits that every woman receives at the main clinic. So it's just so that they can understand that all these tools are there to help them and that the midwives are helping them. And it's also educating the women on our main clinic and what they can receive there, and that we are there to help them. When it comes to educating the mothers of those who are pregnant, our main focus will be that the mothers understand that we are there to help ensure that they have a healthy daughter and a healthy baby arrive. We want the mothers to be a great support group and be with the daughters on a daily basis so that we can ensure that the baby is healthy and that the daughter is healthy as well. Lastly, our overall objective for the clinics, the traveling doctors, midwives, and volunteers, we will give them all kits, and we want to help the future mothers of Pakistan be healthy and give proper health care to themselves as well as their children. So education is part of the process to make our plan successful. So I hope that you've enjoyed our whole video and our project on helping the women in Pakistan have healthy pregnancies and to decrease the maternal mortality rate so that we can have equal opportunities for all around the world. Thank you so much for watching.